I was diagnosed with stage 4 pharyngeal cancer, throat cancer, in April of 2007. The initial prognosis was very, very poor, and so I had surgery that first day, and they inserted a trach tube and a stomach tube, and I had both of those in for about the next 8 months while I was going through treatment. But I was fortunate that my oncologist recommended a cancer clinical trial, and that clinical trial worked. It involved very heavy chemotherapy and debilitating, to a certain degree, radiation therapy. And based on the location of the tumor being right above my voice box, and it was wrapped around my spinal cord, there's a lot going on in that area of the neck. And the treatment not only goes after the cancer cells, but there's some certain amount of collateral damage to the healthy tissue around it. And I suffered with some relatively severe chronic pain. My doctors recommended that I try physical therapy, and I'd heard some good things about what was happening with Mary Freebed and their emerging focus on cancer survivorship and treatment for people living either with cancer or with the effects of the cancer treatment. So I started coming to Mary Freebed, and I worked with a wonderful therapist by the name of Bryan Williams. And Bryan did a good job of not only identifying what the source of the pain was, but I received an education as it went along, and it was just kind of an inspiration to watch him do his job. At about 8 weeks after the treatment started, it was in the middle of the afternoon, and I realized my neck's not hurting today. And I was kind of excited about that, and I went in to see Bryan the next day, and he was excited about it. Everything about the cancer journey has changed dramatically in the last 10 or 15 years. The treatment itself for the cancer has gotten better, more effective. There's more of us that are living longer with cancer, but people like the professionals at Mary Freebed have also learned there's some things that they can do in rehab without pain, and that's the first time I can say that in 6 years.